When I began my practicum in the pediatric emergency department at Banner Health, I spent time observing daily workflows and listening to both staff and families. One thing that stood out was how much emphasis is placed on assessment and treatment, yet how little structured attention is sometimes given to discharge education. Discharge is often viewed as the final step, but for families, it marks the beginning of care at home. Families are often Families are often exhausted, anxious, and eager to leave, yet they are expected to understand medications, follow-up appointments, and warning signs. This is especially challenging in a pediatric emergency setting where emotions run high and time is limited. My practicum project focused on improving discharge communication through a standardized checklist and education script designed to support nurses and families during this critical transition. Throughout this presentation, I'll explain how this project developed, what needed addressed, how it aligned with leadership principles, and what I learned about leading change in a busy clinical environment. This practicum project let me connect leadership theory with real clinical practice. Instead of focusing on a large system change, I aimed to address a practical issue that addressed patient safety and family understanding every day. Discharge communication affects nearly every patient encounter, but it often varies depending on workload, staffing, and experience. During my practicum, I observed that some nurses provided very detailed discharge and teaching, while others had to rush due to competing priorities. Families sometimes ask the same questions multiple times, or return to the emergency department with concerns that could have been addressed at discharge. This inconsistency was not due to lack of caring or skill, but rather lack of structure. The goal of this project was to support nurses by developing a simple, standardized approach that enhances clarity for families while fitting into existing workflows. From a leadership perspective, this project focused on listening, collaboration, and designing solutions that respect the realities of clinical practice. My practicum took place in the Pediatric Emergency Department of Banner Health. This is a high acuity, fast paced environment that serves a wide range of pediatric patients, from minor illnesses to trauma and critical care cases. Nurses must constantly prioritize tasks, manage interruptions, and respond to rapid changes in patient condition. Discharge in this setting often happens quickly and sometimes after long waits or emotionally intense encounters. Families may be overwhelmed, tired, or distracted, which makes education more difficult. Nurses are expected to provide thorough teaching while also managing patient flow, documentation, and new arrivals. This environment highlighted the importance of efficiency and clarity. Any intervention that added time, complexity, or extra documentation would not be sustainable. Understanding the realities of the setting shaped how the project was designed and reinforced the need for practical, nurse-friendly solutions. The need for this project became clear through various assessments. I observed discharge interactions during my practicum shifts and paid attention to how education was delivered. I also spoke with the bedside nurses about challenges they faced during discharge teaching. Additionally, I reviewed common themes related to return visits and family questions. A recurring issue was family confusion around medications, follow-up appointments, and symptoms that should prompt concerns. Nurses shared that discharge teaching often relied on memory and personal habits rather than consistent framework. Time pressures and interruptions made it difficult to ensure all key points were addressed each time. These observations aligned with evidence showing that poor discharge communication contributes to preventable return visits and decreased adherence to care plans. This confirmed that the issue was not individual performance but a system gap. Addressing this gap through a standardized tool was an opportunity for leadership to support both staff and families. This project aimed to develop a standardized discharge checklist along with a brief education script. The checklist was created to act as a cognitive aid, helping nurses ensure that key topics were addressed during discharge. These topics included medications, follow-up care, clear return precautions. The education script offered simple, plain language that nurses could customize based on the family's needs. Importantly, the tool was not meant to replace clinical judgment or personalized teaching. Instead, it supported consistency during busy shifts when cognitive load is high. Staff feedback was integrated throughout the development process. Nurses paid nurses provided inputs on wording, length, and usability. This collaboration helped make the project tool practical and fostered staff ownership of the project. The primary goal of the project was to enhance family understanding at discharge. When families leave with clear instructions, they feel more confident managing care at home and are more likely to follow treatment plans. A secondary goal was to reduce unnecessary return visits caused by confusion rather than clinical deterioration. Another important aim was to support nurses. Discharge can be stressful, especially during times of high patient volume. By providing a structured guide, the project aimed to lessen cognitive load and boost confidence during teaching. Consistency was also a key focus, as even small variations in discharge education can lead to misunderstandings. These objectives aligned with organizational priorities related to patient safety, quality improvement, and family-centered care. From a leadership perspective, the goals highlighted the importance of supporting frontline staff while improving outcomes. Although the project was in the pilot phase during my practicum, several early outcomes stood out. First, staff awareness around discharge education improved. Nurses reported that the checklist helped them slow down and mentally confirm they had covered key topics, even during busy shifts. I also noticed more consistent language being used when explaining follow-up care and return precautions for families. Another important outcome was increased nurse confidence. Several nurses shared that having a structured guide reduced the pressure of remembering every discharge component under time constraints. While long-term metrics like return visit rates and patient satisfaction will be evaluated over time, expected outcomes include fewer preventable returns due to confusion and better family understanding. From a leadership perspective, this phase reinforced that early results are often qualitative and that staff feedback is just as vital as data in the initial stages of implementation. Stakeholder response was a vital part of this project. Nurse leaders were involved early on and provided guidance on feasibility and alignment with unit priorities. Their support helped legitimize the project and encourage staff participation. Bedside nurses were also key stakeholders, and their feedback shaped the final version of this checklist and script. I actively sought input by asking nurses what worked, what felt repetitive, and what might slow them down during the discharge. This feedback led to adjustments that made the tool more concise and practical. What stood out the most was that staff felt heard. Rather than seeing the project as just another requirement, they viewed it as a support. This experience showed me how leadership engagement and collaboration directly influence staff buy-in and project success. Sustainability was deliberately integrated during the planning phase. The checklist was designed to fit into existing discharge workflows instead of functioning as a separate task. This approach reduces resistance and promotes long-term use. One sustainability strategy involves including the checklist in orientation for new nurses, so it becomes standard practice from the onset. Another key element is leadership reinforcement. Nurse leaders can reference the checklist during coaching or education moments, emphasizing its importance without formal enforcement. Regular reviews and small updates will help keep the tool relevant as workflows change. This method supports sustainability by embedding the project into the culture rather than depending on individual memory or motivation. A structured handoff was crucial to ensuring the project continued after my practicum ends. I provided leadership with the finalized checklist, education script, and a summary of staff feedback. I also discussed suggested next steps, including continued pilot use, a collection of outcome data, and potential reinforcement or refinements based on patient experience feedback. This handoff ensured continuity and prevented the project from losing momentum. It also allowed leadership to adapt the project as needed without starting over. From a leadership perspective, this step reinforced the importance of clear communication and documentation when transitioning ownership of an initiative. This practicum helped me intentionally develop several leadership competencies. Communication was a key focus as I collaborated with bedside nurses, charge nurses, and leadership to gather feedback and align expectations. Relationship management also was strengthened through teamwork and building trust. I also developed systems thinking by analyzing how discharge education integrates into workflow, staffing, and patient flow. Quality improvement principles guided the project from needs assessment to evaluation planning. Professionally, my goal was to build confidence in leading small scale change initiatives, and this project gave me experience practicing leadership in a real world setting. What I learned from this project? This project taught me that leadership is about service and support, not authority. I realized that meaningful change begins with listening. Engaging staff early helped identify barriers I wouldn't have noticed alone. I also saw the importance of simplicity. A tool doesn't need to be complex to be effective, especially in a fast-paced settings. Another key lesson was patience. Change takes time, and early feedback is part of the process. Not every improvement is immediately measurable, but early qualitative outcomes still matter. This experience boosted my confidence in leading quality improvement efforts and strengthened my interest in leadership roles that support both staff and patient outcomes. To conclude, this practicum project enabled me to apply leadership concepts in a meaningful way, improving discharge communication, enhanced patient safety, family understanding, and nursing practice. The experience helped me grow as a leader and reinforce the importance of collaboration, evidence-based practice, and sustainability. Following slide lists evidence-based sources that help support this project.